So, thank you very much for being here. Good morning, everyone. Professor Onye and Doris and these wonderful students. It's a privilege to present for you today. Yeah, and once again, I'm Afor, a Cameroonian-based guitarist, music director, and nature photography enthusiast, a young scholar who is pursuing a career in music therapy. Yes. Today I'm presenting on the effects of music therapy on the physically, emotionally, and mentally challenged. So we're looking at some hypothetical questions. While I was going through doing this assignment today, I started thinking about these things. You see, what is the origin of music? Did music start with God? The second question there is, who is the first music therapist? And the third came, is it God? The other one, who was his first student? The following question there is it Lucifer? And where was the first therapy class ever held? Do you think it's in heaven? So, the other question, who was the first music therapy patient? And last one, how do you think music therapy originated? Like I said, hypothetical questions. These are just the things that were going through my mind while I was preparing this. And it struck me to realize that music existed before the creation of man. And looking at the evolution of music, it has gotten to a point where we have different branches and everything. And here we are talking about music therapy. So it tells us that music therapy, the power in it, what makes it a tool which can be used for treatment and healing, actually has been there before the existence of mankind. Because when we look at the creation of man, you see that the Bible talks of music being there. God created Lucifer. Angels were obviously created before men. So looking at that, and I read Charles Darwin, who propagated the theory of evolution that man came from matter. He said music had its source from that. He said something that music came through. There's this experience animals have, especially birds. They will sing to woo their mates before they will finally meet and have intercourse to procure their young. So he said that's how music originated. So I brought this up because someone might say, okay, you are being religious as a Christian. Yeah, get someone who is not still predating the existence of music before man. So these are the questions that are going through my mind. I told him, make me understand that music therapy is extremely powerful. There is potency in it, which gives us the capacity to present things like this and to say music therapy has positive effects and we can study and practice it today. So the next thing is, what is music therapy? Who is a music therapist? Who are the physically, emotionally, and mentally challenged? And what are therapeutic effects? The very first day we had this session in the Doris office. Lindsay gave a presentation which I would like to give again. Yeah, for us to perform. No, the definition. You defined music therapy, I would like to give that same definition.
Music therapy is a clinical-based intervention practices that uses music and musical elements to heal children or people that are especially in need of it.
Thank you. So with that definition, we see music therapy, clinical-based, evidence-based music interventions, and you hear of using it by a credentialed person, a professional, to treat people with emotional, mental, and physical challenges. Now, we say music therapist, of course, is someone who practices music therapy, but someone who has been trained to do so. Not just any kind of person can be called a music therapist in this context. You must have gone through some training. And I read an article written by Professor Onye Nwankpa, where he was giving a definition on music therapy, and he said he was quoting another writer whom I can't recall the name now, but he said music therapy is the use of sound energy to administer treatment to people with health challenges. And when you talk of sound energy, what makes sound have energy is the properties of sound, like vibration, resonance, all these things. That's why you can have that sound and you can relate with it. So those are some of the definitions and the things we'll be working with today. So what are the emotionally, physically, and mentally challenged? We are talking of people with physical challenges. For example, you have people with stroke. Someone who is a who has stroke, some of them are bedridden, some can't move well. You have people with emotional challenges, people suffering from depression, trauma, and you have people with mental challenges, you have psychiatric patients. So these people have normally again. These are the patients of the music therapist. So those are the emotional and physical and mental challenges. And also we say what are therapeutic effects. This is just the outcome of the therapeutic procedures which the music therapy will use to administer. So after administering this, you have the effects. So how does the patient respond to treatment? So that's it. So we see this discourse examines the therapeutic effects of music on people with developmental disabilities, mental health conditions, and substance use disorders. When we talk of substance use, we're talking of people having challenges with drug abuse, so things like that. And we have children and adolescents with emotional and behavioral challenges, older adults, trauma survivors, and families or groups. So music therapy can be administered to different families and to groups if they have challenges. The office can call you on to administer treatment. So essentially, anyone can benefit from a non-verbal, creative, and engaging approach to address their physical, emotional, cognitive, or social needs. Engaging approach to address their physical, emotional, cognitive, or social needs. And such people could be the patient of the music therapist. Now, to practicalize this, we all use music therapy to celebrate, to meditate, to mourn, to learn, depending on the circumstance. Some people were doing sports the other day. I went out at the sports complex there. So we had people from different walks of life, different angles. There was this group here, this group there, individuals were doing sports. And one thing you will notice is almost everybody had an earpiece or they had a music box while they were doing sports. So one group came and their music was so loud. Then a tout came claiming to be a staff who was given the responsibility to bring order in that place. He was collecting money for people. So he said, I don't like that music, And he went to these guys, stopped them, said, you cannot play that music here. So he brought order actually. But the interesting thing here is this. Why was everyone using music?
Why was
everyone using music? And when they stop that music, those people.
I said for the activity.
Exactly. So when he succeeded in stopping them from using the music, everything became boring for those people and they left. I was there with my earpiece and I continued my sports, jogging and stretching and everything. And I've noticed this. When I don't have that music on, I can't really engage with sports the way I do with the music. I can run for 20 minutes without feeling it if I don't have that music. I won't even know when it's 20 minutes unless I look at my watch. But without that music, at 5 minutes I think I'm at 10. So that's how powerful it is. So everyone can benefit from music therapy. That sound energy we talked about, we all relate to it, that's it. So we're going to be looking at different categories. I didn't just group them like physically, mentally, emotionally. I actually took time to split them and make them a little bit more specific. So we have about 9 of them, and the very first one, individuals with developmental disabilities. So we have people suffering from autism spectrum disorder, Down syndrome, intellectual disabilities, and other things. So you see a picture there of a young girl. That's a picture of Down syndrome. That's a picture of a lady with Down syndrome. What makes you think she is suffering from Down syndrome?
The face. The structure and discuss the face of the individual.
Yeah. And I actually went to read about Down syndrome. Normally we all have 23 chromosomes. From the parent, 23 from the mother, 23 from the father, and total will have 46. So Down syndrome they have 47. Because chromosome number 21 multiplies itself. And that's what causes that developmental challenge. And I've actually seen someone with this before, but I never knew it was called Down syndrome. Yeah. That girl was 20, she was above 25 years at the time, but she was looking like a 13-year-old girl. So, such people can benefit from music therapy. This particular girl was living in a house, she came to spend some time with us. And she was always fascinated with music whenever I'm practicing. Whether I'm practicing at night or during the day, she never knew why. Her mother loved singing. Whenever her mom would be singing, she would sing with her. She was always with her mother, caring for her mother anyway, because her mother had an accident. So, that's someone so
because I
had an accident.
Oh.
Yes, a very severe accident. They poured acid on her when polygamous in that fight. So she was the only one, since she wasn't going to school, she wasn't doing anything, she was the only one at home to care for her mom. Yeah, she could still function, but in the course of doing this, I now understand why that lady was creating music. It was therapeutic for her. You often find her sitting alone singing. Yeah, so that's she was administering music to herself instead of listening to herself.
You are the middle therapist yourself.
Okay, yeah, so such people, music therapy enhances communication, motor skills, emotional regulation, and social interaction in individuals with developmental disabilities such as autism and Down syndrome. A practical example, children with autism spectrum disorder often respond positively to rhythmic patterns. In a clinical session, a therapist uses a drum to engage a non-verbal child, gradually encouraging taking, eye contact, and vocalization. I experienced this. There's this autism child in the church where I used to play before. Whenever we close service, she will come and sit back, observing the drum. Immediately the drummer leaves, she picks up that stick and starts beating the drum. Now, when you send her out of that place, she will go somewhere and still holding her head and shaking her head like that. But whenever she gets to that drum, she's very much calm. You can tell her what to do when she's on that drum. Out of that place, don't tell her anything. Yeah, so music therapy helps such people. And the second category, individuals with mental health challenges. We're talking about people with depression, anxiety, post-traumatic stress disorder, schizophrenia, bipolar disorder, and other mental health challenges. So you see, such people are often withdrawn. So music helps mood regulation, self-expression, coping mechanisms, and cognitive function. It helps individuals manage symptoms of depression, anxiety, schizophrenia, and bipolar disorder. It provides a safe avenue for expression and mood regulation. So, a practical example, in a psychiatric facility, patients participate in group songwriting sessions. A patient with schizophrenia expresses auditory hallucinations through lyrics, which the therapist uses to understand and reframe the patient's experience. Now, on top of auditory hallucinations, these people they hear voices, and these voices give them instructions. So, the person said, I heard someone told me to go and shoot this person. It's common in America, we see it in the news. You know, that's what's meant by auditory hallucinations. So the music can help these people express themselves. So if they engage with the music therapist, it's going to make things easy for them. For instance, a professor in Harcourt was discussing with her the other day. She said, she told me of a young girl who committed suicide. That she failed job.
This recent job.
Yes.
In Lagos.
Yeah.
And she killed herself. So I was laughing. Then she said she does not know what's happening to the young generation because she has a colleague who is not a professor who fails JAM 10 times. And yeah, 10 years. So imagine someone failed once committed suicide. It is obvious that this person didn't know how to express, to handle pain, to express it. For us who are in the music field, this feels normal because you can easily write a song, express your pain and sing it. You can easily pick up your instrument and play out your souls, play out your joy. You can dance to tunes, you can flow with things. For someone like me, I will snap pictures, I will listen to music. All of us, it seems easy for us, but some people don't know this. So, that day committed suicide. From her assertion and her conclusion, the girl did not know how to express this. She needed a coping mechanism. She couldn't find it. Which is one of the things that makes me feel happy because with things like music therapy developing itself in Nigeria and Africa, Cameroon, and Africa, such people can have places, avenues to go to. Because now people, mental health issues they are not that severe. The awareness in Africa is not as great as it is in the Western world.
So everybody's coping.
Yeah, probably the statement the other day, where everyone is sick. We all have issues.
Yes, we all have.
They are all handicapped in one way or the other.
Yes. It's just at different levels.
Yeah.
So all of us need this one way or another. I was in Ghana and a psychotherapist. I was in her house. She's an American and she was working with patients from the US. So she works twice a week and we sit there, we receive calls, administer treatment to these people. After that, she goes up like 2 hours a day. Now, what fascinated me was one of those patients called and she said, oh, I'm not supposed to work with you because you don't fall in the category of clients I work with. So I'll refer you back to the organization you meet this person and the person will connect you with a specialist for your case. I could hear this guy, I was a white guy, begging. He said, please, I really need this, I really need this. He was like, sorry, I can't do this. It's not ethical for me to practice with you. So, I was really amazed. These people are that organized. We are getting there. That's what we do. And I have people like this taking us there. So with these people, music therapy is very essential to them. And our topic again, the effects of music therapy on both physical, mental, emotional, and challenge. So we go to next, individuals with neurological conditions. People who have stroke, traumatic brain injury, Parkinson's disease, Alzheimer's disease, multiple sclerosis, or other neurological disorders. So, who knows this man in the picture?
Is he his condition?
No, forget about the condition. Who is that person?
The man in Pakistan.
Yes.
I can't say it.
No.
Do I know this?
You will definitely know him. It's a boxer.
Oh, Muhammad Ali.
Muhammad Ali.
Oh,
Okay.
Look, now this woman was like extreme dexterity in the skill of boxing. But you can see that if you don't need a prophet to tell you he can't box anymore. If you look at his mouth, you know that he has challenges with communication. It's true. Yeah. And his prime was almost unbeatable, untouchable, until Parkinson's disease caught up with him. I watched his last boxing match and his opponent was like a yard away from him and he was doing this. Come on, let's fight. He was doing this and trying to punch. But the punches would not reach the opponent. And the opponent was like, I can't do this. I can't fight someone like this. And they all cheered him, he wasn't happy. But Parkinson's disease at the time, Muhammad Ali started suffering from him. The world did not know it as Parkinson's disease. Like, it was strange. They were still trying to find out what was troubling him. So finally, they used other forms of therapy and he lived and died. Was it around 2015 or 2014 when he died? I think it was over 70 years old. So he found ways to ease and we just keep those things and continue. Please can you just do that later? So we found ways to do that, obviously, through different therapeutic interventions. And music therapy will help this one. I'm a bass guitarist. I use my left hand and I use my right hand. And I can play right-sided, I can also play left-sided. But I'm not very good with the left side because naturally I play with my right hand. When I learned about ambient dexterity, being able to use both hands and maybe legs, I started practicing to play with my left hand. I noticed this. My left hand, normally I'm right-handed person, but these fingers are extremely fast. Faster than this use. And I started training it. I realized how difficult it is to use my right hand and play bass guitar. I can play at a slower pace, but going fast, I won't go. But here I can. So it tells me that music trains muscle memory. It improves nerve action. And that's how powerful music therapy is. Such a person will benefit from music therapy. So you see, music therapy. They may use music therapy to address motor skills, like just to say, speech, memory, and cognitive function. Learning a musical instrument like the piano trains the muscles to move. Singing also aids self-expression and exercises the muscles responsible for speech. So my mother forgets a lot, she's going old. But she has never forgotten the lyrics of the songs she used to sing back in 1970. She can forget every other thing, but not lyrics of those. We have devotional to meaning. She never forgets you're only at this time, and this thing happens. That's how she reports the events at times. So now I told her the other day as I started, I said, start learning the piano. I have a piano in the house. My elder brother is a musician like myself. I told her you should teach her. And that her hand which has a challenge, she will find ways to cope with it. She was excited just by me telling her that. She was like, wow, okay, I'll start doing it. So that's how powerful it is. We have the fourth category, individuals in medical settings, hospitals, rehabilitation centers, and hospices. Hospices, like I said, I'm music therapy. I got to know of this wise story here. And the hospice homes, people who have terminal disease or they keep them there. The term holistically means people, they have a time frame to die. Hospice care, we care for them to see people die instead of suffer from this terminal disease. In hospitals, music therapy is used to manage pain, support rehabilitation, reduce anxiety, and promote recovery, provide emotional support, and improve quality of life. That's palliative care. So, the therapy in this case, in the case of patients in the hospital, is not necessarily to heal them or treat them like orthodox medicine will be, is to help them to ease that process of treatment. That's what we call palliative care. So in the case of hospice care, Professor Nwankpa gave me a very powerful example some weeks back. He told me of his early exposure to music therapy. He lost a friend and she died smiling. She died with a happy face. Now, I don't know if anyone has experienced a near-death situation here, but I've seen someone die. My grandmother, she was beating herself. She said people are coming to take her. They should call all her children to come. She never opened her eyes all that time. And my aunties traveled from different towns. Okay. When they came, she said, is everybody here? They said yes. But one person was not there. Grace, she said, where is Grace? Let Grace come. Grace will not come. They made a call. Grace was on the phone. And when they said Grace cannot come because of this, she said, okay. She was busy and said, they're coming to take her. She had said she wants to die when all her children are sitting there. Since everyone is present and Grace cannot be here, she cannot die. And she died. Wow. So when Prof told me that, he told my grandma. And he said, what was this? They were playing music to this lady while she was in the hospital. So imagine someone dies smiling. Death, I think, is scary. I've had such an experience before, but it's scary. When you see it coming, it's not something that you will die happy, like you basically we all will die someday, but to show us how scary death is. If we say, you want to go and meet God, who wants to die now and go and meet God? Nobody wants to.
I'll go.
You will live.
Let me see it.
Okay.
Let's go and get home. Quick, get me. Why are you laughing?
No. It's
It's like example.
It's not about that. You just gotta go to heaven.
Okay, so if you know you are going to heaven, you accept
If
that.
it's heaven, I'll just go.
One of my friends told me she cannot, like, rapture cannot take place until she's married. Until she's God knows that rapture cannot happen. She has to marry.
No be lie.
Then again, yeah. So we have the next category. We have people with children and adolescents with emotional, behavioral challenges. So music provides an outlet for children and teens struggling with anger, impulsivity, trauma, emotional dysregulation. It builds self-esteem. Builds self-esteem, encourages emotional literacy, improves mood, and promotes positive peer interactions. I want to use a very practical example in this room. Divine. When I was here in 2023, the person I saw and the person I'm seeing are two different persons. So she's looking totally different. I don't know if you are teachers, you are friends, we know what I'm talking about. That's how powerful music can be. She's bold, I see boldness now, confidence. So then
It's
she's.
because she's now my friend.
Okay, so I saw a video of her singing, but back then she was scared of even taking the piece and the food. Yes. So the other category we have older adults. You see an old man there suffering from dementia. He's lost. Someone is talking to him. Like I said, my mother forgets, but with music, she recalls. So we have individuals with substance abuse. The fascinating thing about this in the course of my study is if songwriting is a means for these people to express their worries, like during their relapse period, relapse in the sense that when they are engaged in a therapeutic intervention to stop the substance abuse, those moments when they are going back, they have something they can run to pin down those emotions, write it down, they can sing, play instruments, and the practical example. Yeah, it should be a very serious lesson. Alcohol and other things. Yeah.
Wow.
That's usually very innocent.
Okay, so individuals experiencing trauma. So we have individuals experiencing trauma. So music provides a non-threatening medium to process traumatic experiences to restore a sense of safety and regulate the nervous system. And the final category, conflict resolution, families and groups. So music therapy strengthens family bonds, facilitates communication, and enhances group cohesion and shared experiences. It is particularly useful in family counseling, support groups, and community healing after conflict or loss. I don't know if anybody has tried practicing, for you especially, practicing music with your parents.
Yeah,
Yes.
let's see that.
Yes.
How was it?
It was so unique.
They used to enjoy the
Fire.
The bond.
It strengthens the bond. Right?
Yes, the bond.
There are things you naturally not discuss with them in that process. And discuss.
Yes.
And they can start sharing you memories. Like the father can tell you about his ex.
But we have space.
Yes, go ahead.
What it says, let him.
Yeah, okay. So there's an exercise you take, but let me just read out this compulsive thoughts. Then we think that we do that exercise. So music therapy. Okay, please. Music therapy is the intentional use of music to unite the spirit, soul, and body of man. It uses music to directly influence the mind and harness its power to affect man's spiritual and physical realities to such extent that orthodox medicine and other forms of therapy will not. Music therapy demonstrates immense potential in addressing a wide range of psychological, cognitive, and emotional needs across the human lifespan. Its flexibility, accessibility, and emotional depth make it a unique tool in both clinical and community contexts. By harnessing its power appropriately, professionals can significantly enhance quality of life, facilitate healing, and support human development in diverse populations. So that's my conclusion after going through this study. Thank you very much.
So much, Mr. Afor, for this wonderful presentation. We're going to use 5 minutes to take some few questions. Please just go direct to your questions, and at the end, we'll ask Prof to say something. Thank you. Auntie?
Thank you, ma'am. Thank you for the opportunity. I have a question. man. He should be in his, maybe, if I'm not wrong, maybe early 50s or late 50s. So he was going through his traumatic childhood, and he was the first child and everything he said. And the way he was recounting, I want to be sure of something. He said that what he went through as a child, that even as an adult, even at that age, he's not married. He didn't get married because of the trauma. He couldn't get married, he couldn't heal a lot of things, and he went through emotional abuse. So I'm like, what's the possibility of someone taking an emotional abuse into that age? Because I felt that, like, I used to feel that maybe in your 30s you should be able to move past some certain experiences and heal. So what causes that? What's the possibility?
Okay. In my opinion, I would say environment. And what I mean by environment is this, not just the physical environment. You have the physical environment plus the people around you. Another thing is, not everyone can receive love. People can give love, but not everyone can receive love. I used to be a very proud person. Proud in what way? When ladies give me gifts, I'm like, a woman cannot give me gifts. Then one day, I was reflecting, and I believe the Holy Spirit spoke to me. He said, Paul, you give gifts to God, you give your offerings, and you expect God to take it away. I said, yes. He said, you and God is richer. I said, God. He said, okay, so why does he receive your gift? And I learned that day that receiving is humility. Now, not everyone can receive love. There are people you try to talk to, and they will be so engrossed in their problems that they don't give you a listening ear. Environment in what way? Environment, the friends you keep around you, can they influence you positively? So when someone goes through such a situation from childhood to that age, it means if you look at the timeline from childhood to the 60s, or whatever age it may be, you realize that person didn't either receive, didn't open up, or the person was in the wrong environment. So that's what I'm saying. But I know of someone too in the 60s now, I don't know, Tony McClough, I don't know if you know him.
Yes.
There's this song, These Are the Days of Elijah. He was sexually abused by his uncle. Yeah, when he was a child, maybe 12 years old. So abused, sexually abused. But till date, he's not married. Yeah, he's not married. And he's a powerful musician. I dare you to think that that man, music, has been a powerful outlet for him. At 9 years old, he said he was preyed upon by Andrew Crouch. I don't know if anyone knows Andrew Crouch.
Yes.
Yeah. 9 years old, he attended an Andrew concert and he was looking at the man, wowed by that ministration. He's like, God, I want to be like him. So when everybody left, he stayed in the hall. Musicians were supposed to go backstage. So when Andrew Crouch was about leaving, the hall was empty. So he had to wait for everybody to leave. So when he came, he saw this child. He's like, hey, what are you doing here? He said, sir, I want to sing like you. So are you serious? He has been great. And today, music is helping him. I think to stay without a wife is a difficult thing. Yeah. So,
Alright, so do you have any other questions? Question from me? Alright.
Okay. Good afternoon, everybody. When you were talking about Down syndrome, you made mention of amount of chromosome. That particular place was not really clear to me.
You want marry now?
You said, I think, it's an additional chromosome to the normal humans that causes such things. So I'm asking, how many should it be? Because I was confused with the number you mentioned.
I read about it and discussed it with a friend who is a medical student here in Illinois. So, and what I read and what he shared with me were the same. So normally we have 46 chromosomes. Yeah. And what are chromosomes? That does that it has to gene carries the basic matter for our composition. It determines how we look, how we feel, and everything about us. So chromosomes, genes are embedded in chromosomes, so genes make up the chromosomes. So when mutation is taking place, so what happens is you should have 23 chromosomes from your father and 23 from your mother, which makes 66. Yeah, but people with Down syndrome have 47 because yes, because they say the chromosome 21. So you have chromosome 1, chromosome 2. So chromosome 21 multiplies itself. So that's what happens. And when it does that, it distorts everything about your developmental process right from the womb. That's why you see them having funny shapes of faces. Things like that. I have a friend who has his head.
Alright. I think we are done with questions. Let's hear from
Well, I was thinking that I would just come here and listen, not say anything. You know? But let me first and foremost appreciate the presenter for his boldness in doing the. Secondly, let me appreciate Dr. Doris who acted out the plan for this presentation. And this becomes quite a practical demonstration of our thinking, because in music, we have the theoretical component, we also have the practical aspect. Sometimes when we do not have, the theory, we can read and do that, but the practice that comes through application, if you do not have the opportunity of hearing that and saying that, you will think that it's just a mirage. You won't be able to sum up the courage to do something or to try something that will go to benefit somebody. So I thank you, and I thank the students too, who, especially the people who were here yesterday. That's my office,
We didn't know.
So,
we thought that
We thought it was an exit. So when I was there, I was hearing boo. That was when I came up, and saw you playing here. Because I wanted to really deal with the people. Yeah. So it was quite exciting. So thank you very much for making this place again accessible to us. The initial plan for this place was for the graduate students. This is more like a lounge. After classes, they receive classes somewhere else, can just come here and relax, eat their food if they have their food, do their assignments and so on. If there are classes here too, that can still, the teachers can just come and teach them, to give them that kind of, clout, so all of a sudden things shifted, but I thank God now that we're going back to
Normal.
what we have learned and begin to use this place. And of course, the first people using this place are those in the music therapy, and it's a graduate student. Back to his presentation, and again I thank him for his composure in presenting and giving us also his own personal account. It was not ended up just telling us what happened there. what they said. He also involved himself so that you know that music therapists function as individuals. You know, they are not ghosts, human beings. You know, and there was also something that you probably must have gotten is the fact that the music therapist is also a psychologist who derives changes based on the environment. You see somebody, you see a student, you see somebody, sitting down, you'll be tempted to ask the question, hey, hello, are you okay? Or what? Or you see the nature. If you see somebody, you know that something has gone. As music therapists, you need to have your thinking caps, to be able to really profile, solution to the patients. Music therapy is a scientific, systematic method of providing solution to people, whether you are a child or an adult, suffering from mental problem, physical problem, emotional problem, or you are even surrounded or shrouded in a traumatic circumstance. So you have this, this ally, which is a medical ally that helps in transforming these people, rehabilitating these people, so from their very low states they can now rise. Or if you are, someone is sad, they can be happy. It can also help in the mobility. I remember many years back when I was in Canada, I got into a workshop and got a magazine, that was demonstrated in the context that neurons that wire together, fire together. Neurons that wire together, fire together. And so when you have, the system, our system is so complex. But if you have them connected one way or the other, there will be an igniting power, energy that will make them fire together. So in the process of firing, there is a healing, or there is an elevation, there is a transformation. That's why somebody can just, as he was also, recalling from my conversation I had with him, somebody could die happily. Just die happily. You know that you're dying, but because of your engagement with, a mystical energy, a force that provides pleasure to your mental, state. You'll be happy. When you say, I don't care, I am happy, die happy. So that's what it's all about. However, in his presentation, I hope you won't be mad when I when I put however. After praising, I put however, I know what will I just, as you were presenting, I didn't know what you were going to talk about until you adjusted the laptop, for me to see. It was a too weighty title, for a presentation. A presentation like yours will be more of a case study. What you did was a general lecture that your teacher will give you. Then you now go pick up cases and focus more on those cases, to educate your audience. So that was one place. Even though he was trying to do that, but knowing fully well that you have a limited time, I'm not quite sure that he said all the things that he probably wanted to say about some of those cases. For instance, in certain effects, who is mentally challenged. That one, there are so many cases on mental cases. Talking about emotional. So many. You can talk about them from here till Sokoto. We are still talking, just trekking, walk from here to Sokoto. We are still talking about. We are talking about what's the other one? Physical and physical. There are cases like that. So that's that. And I tell you that right now in the world, there are many associations that are associated with music therapy. Those who are in music therapy can work in hospitals. Assuming that, say, your mom or your dad or any of your relations have wanted you to answer doctor associated with a hospital. Music therapy becomes a way out. Assuming you have your own passion for music and somebody is doing it, then you can align it towards music therapy, because music therapy is an ally to medical services. I was just talking about chromosome. Are you talking about chromosome in art? The hormones. Over 80% of our hormonic structures are just fluid. I ask you one question. In terms of energy, sound energy, have you ever seen the old people constructing speakers?
Yes.
Loudspeakers. And then we will take off the mid-range or the lower range, the bass. When the sound will go boom, boom, and you see the thing. The sound, the energy will just be moving the thing. You see it, boom, boom. Sound does not have any energy. Sound, I'm talking about, doesn't have any energy. But is it true? There, I tell you that it truly has energy. If it's full, it's able to move that. So, if you now look at your body structure and so on, think of what sound, well-organized sound, can do to a system in providing healing. You know that sound has energy. If you now go back to the Bible, thinking of the Jericho walls, you know that sound has energy. You go back also to think about the Silas and Paul and Silas, even though we have a Paul here. You just did not talk about Silas because they thought somebody was going to compete in his so refused to mention Paul and Silas in the Bible. You know that music, they were praising. In the process of praising, the gate got collapsed.
The incessant intensity.
And do you know, if you go to churches here, praise and worship. But you will see a lot of energy.
Yes, sir.
Those who ordinarily would not want to be dancing, they will come out, they will be dancing. That was the one way. And at the end, they will just be sweating like Christmas goods. They will just tell you how happy, how excited everything was. Have you also heard that he who sings praise twice? If you sing, it's music. You produce You know, it's only music. It's only music. I mean, you can pray. Sincerely, you can pray. God will listen to you and answer your prayers. I'm not saying that God doesn't answer prayers. You pray, God will answer your prayers. But when you put your prayer in the context of music, you are bringing God down to a level. And if the person is closer to you, to attend to you, you know that they will hear even the small whispers. That's what music does. You know? There are many, you know, I was telling him, also you should come. If you are in music therapy, you will get scared. Especially when you are involved in palliative music therapy session, where you have to provide music that will anodyne the pains people, especially those who have been structured, organized, you know, or that terminally ill patients. Those who are, say, in 1 month, they will die. 3 months, they will die. 6 months. They know abroad, they know. They are told. And it just shocked me that the person one white guy who came when I was doing this therapy said, hey, you know, when you come next time, you're not going to see me. I didn't understand that. So I just laughed. You know, they will start playing the music. Then the caregiver, the head nurse and the hospice there came and said, bro, come, live with me. So when he was doing, he was just back and still laughing. And then the woman came back and told me that Robert was going to die in a month's time. And that's what he was telling me. Lo and behold, he had calculated when I was going to come. When I came back, he now came to tell me, you remember Robert? Remember the one I was telling you that we were not going to see? So why is it? How come it's not here? I was just looking at it. He told you it was going to be there. Hey! I got frightened, you know. It's like just, you know, this is death. You know, the death was coming to tell the age. I'm going to, you know, interacting with somebody who is in. So, but you must know that God has structured human beings in a certain way. We go and come and that kind of thing. So, those individuals will have to be strong emotionally, because that's the only thing that you can use to encourage others. And there was also one thing that he just did, you know, it's talked about ambidextrosity. You know, an ambidextrous person, somebody whose left hand is functional and as effective as the right hand, if it's a right-handed person, or if it's a left-handed person, the right hand is as effective as the right hand. You know? Okay. I will try not to mention some people that you know that are right-handed and left-handed. You know. But you know that I am right-handed. Yes. Yeah. Let me use myself. Music, conducting music helped my left hand to be so strong in giving gestures. I can do all the conducting with my left hand and put this one in the back. You know. So it was before originally, you know, it was almost like mirroring this one. But I worked with music and so on in such a way that my left hand side became almost completely independent of my right hand side. I can do something different from what my right hand is doing. And did that. Of course, in music and things like that. So, thank you very much. I hope we'll have opportunities of having this focused, the more focused presentation in terms of cases, and we can also go outside into schools. There are schools, providing rehabilitation services for people. So, when we have that competition, we can go to some of these schools and offer our services as music therapists. Thank you very much.
Thank you so much, Prof. So we have 3 minutes exercise on today. So let's take that 2 minutes.
So